Hi, I'm Andrea Watkinson, Executive Director of Cancer Services for Unity Point Health, St. Luke's Hospital, and the Nassif Community Cancer Center in Cedar Rapids, Iowa. As a leader in cancer screening and treatment in Iowa, we're proud to sponsor the Iowa Ideas In-Depth Week Cancer in Iowa series. As Iowa continues to see some of the highest cancer rates in the nation, it's more critical than ever to address the issues causing this trend and to educate our communities on the resources available in our state. This series will take an in-depth look at everything from cancer rates and causation to research and long-term impact cancer has on the state of Iowa. We'll also discuss advancements in treatment and how crucial it is to complete your cancer screenings regularly and on time. We hope you find these sessions informative and find valuable takeaways. Our overall goal at Unity Point Health, St. Luke's, and the Nassif Community Cancer Center is to reduce cancer rates and work towards a healthier state for all Iowans. Enjoy the event.
Okay, hi everybody, and welcome back to, or welcome for the first time, Iowa Ideas In-Depth Week. It's actually our 9th year doing Iowa Ideas here at the Gazette. It's basically a series of events exploring topics important to Iowans across the state. And we're really excited this week to have a conversation around cancer in Iowa. Before we dig in, just real quick, want to kind of recognize and thank the sponsors for this event. We have our presenting sponsor, ITC Midwest, as well as our In-Depth Week sponsor, Unity Point Health, Cedar Rapids. So thanks again to those sponsors for their support and for this event and these conversations. Just so folks online and some attendees know, you'll be able to submit questions kind of throughout the panel by entering them either into the Q&A box on Zoom or putting them into the Zoom chat. Those will get sent to me and I'll kind of try to work them into the conversation if there's time. So welcome to our 4th of 5 in-depth week sessions. Today we're going to be talking a little bit about economic impact around cancer and cancer treatment. My name's Grace. I work over here at the Gazette as a local government reporter. And today I'm joined by 3 panelists that are going to have this really awesome background and input on this topic. I'm going to let them go ahead and introduce themselves. And so I think, Shannon, we can start with you. Just tell us a little bit about yourself and how you're involved in this field.
Sure. Hi, everyone. My name is Shannon Greene. I am the CEO with Ronald McDonald House Charities of Eastern Iowa and Western Illinois. And I'm happy to be on the panel and representing the 3 different Iowa Ronald McDonald House charity chapters. Our mission is really around providing comfort and support to families with sick children who are traveling for their medical care. And so we serve pediatric oncology families who are traveling to the Iowa City, Cedar Rapids area for that treatment. So I'm glad to be a part of this conversation.
And Christina, I'll have you go next.
Hi, I'm Christina Djerf with the Halperine Cancer Center in Cedar Rapids, and I'm really glad to be here. I appreciate being invited. I am the community liaison for the Especially for You Race Against Breast Cancer at Mercy Medical Center. And on a daily basis, I work with community partners to break down barriers and increase access to cancer care, making sure cost doesn't stand in the way of screenings, diagnostic testing, follow-ups. And as a Cedar Rapids native, I'm proud to help the people right here in our community. And this work is really incredibly close to my heart. I had a friend who passed away at 45. Our kids were on the same hockey team together, and just watching her go through that journey stuck with me, and so that kind of motivates me. And now I'll turn it over to Jackie.
Thank you. Hello, everyone. My name is Jackie Cale. I am the Government Relations Director for the American Cancer Society Cancer Action Network, also known as ACSCAN. I might refer to it as that as well. We are the advocacy affiliate of the American Cancer Society. So what we do as ACSCAN is we work to pass evidence-based policies at policies at the state, federal, and local levels. I've been with ACSCAN for about 6 years now. I've also worked as the grassroots manager. So I worked with volunteers helping to uplift their stories and really teach them how to advocate to their elected officials to ensure that those stories reach the individuals and elected officials that are making the policies. So Honored to be here to talk about this topic. I know this is a growing issue among a lot of cancer patients and the cancer community. So I'm really honored to be here to talk about it.
Yeah, and thank you so much to the three of you for being here today. All of you guys kind of have different touch points on this topic, and so I'm excited to see how those kind of overlap as we continue this conversation. I think we're going to start a little bit broad and just chat a little bit about when somebody asks, well, cost of cancer, what does that really mean? What does that mean to you guys? And I know it sounds like you have, like I said, those different touch points, so that can be relative to your work or just what you've kind of heard within the community.
I'd be happy to start. From our perspective with Ronald McDonald House Charities, we're dealing with pediatric oncology patients, and families, especially in rural Iowa, are having to travel for their medical care for their child. And so that means kind of uprooting the whole family, the patient, the siblings, and being away from home for maybe a few days, few weeks, few months. And so when we think about the economic impact, the medical bills are their own separate thing. But on top of that, we work with families who also are having to figure out, how are we going to afford a hotel? And, eating out 3 meals a day on the road, and paying for, the parking ramps and all of these added expenses on top of, what's going on for their child. So, our mission is really to help alleviate those costs, at least diminish some of that financial strain for families, but it can add up, especially, you think of food costs right now and eating out alone and being away from home during such a scary time. That's a cost I think families don't think about. You just initially think about the medical costs associated.
And Jackie, it's my understanding you guys have kind of had a conversation internally in some studies around medical debt. And so when we think about that, tell us a little bit about that. How does that factor into this conversation?
Yeah, so ACS Can has really started to look into what does the cost of cancer look like. We, specifically from a policy perspective, we know that cancer impacts everybody, but it doesn't impact everybody equally. So how can we dive into where are the disparities among cancer patients? So we know like certain factors are going to impact how people get diagnosis, treatment, survival, and how they deal with the financial hardship. So those can be like race and ethnicity, health insurance status, income, and then, where a person lives is a huge factor, keeping in mind of like that transportation piece. So in last year, April 2024, ACS Can put out a survey to cancer patients and survivors about their experiences with medical debt. What we called the survey Survivor Views. And I just wanted to walk through some of those statistics that we found within this survey. I have them written down, so if I'm looking down, that's why. It was estimated about 40% of U.S. adults have some form of medical debt. When we think about cancer patients, that number goes up. It's about 47% of cancer patients and survivors have incurred some form of medical debt in order to pay for their care. What's really shocking about that 47% was that 98% of that 47% had healthcare coverage at the time that they incurred the debt. So that is something we are consistently hearing, is that people with healthcare coverage are still taking on large portions of debt to pay for their care. Some other statistics I just wanted to mention were 42% of cancer patients depleted their entire life savings after 2 years of diagnosis to pay for their care. And then also we looked into what future care looks like. So we learned that 42% have delayed medical care because they did not want to go into debt further. And those with cancer debt were 3 times as likely to be behind on their cancer screening. So we know when people are behind on their screenings, they're going to get diagnosis at later stages, which means survival is less likely, it's harder to treat, and it is more costly in the end. So those are kind of some of the main takeaways that we found from that survey specifically. But I also really want to stress what Shannon mentioned, is that the impact of medical debt is extremely hard to measure, because that is not always including, food, lodging, transportation. Time off of work is a huge one. A lot of people have to take significant time off of work. So loss of wages, childcare, things like that are hard to really put into a statistic like that. So
Jackie, I'd add to that too, for so many Iowans who are involved with agriculture, if you're a farmer and you're self-employed, you don't have, a big personal time off bank of time you can take and still be paid for being away. When you're gone, there's no income there. So I think being a rural state, that impact can be even greater.
Yeah. I was just going to say, Christina has a lot to add here.
Yeah. So normally when I think of the cost of cancer care, I often don't think of just about the treatment. From my perspective at EFY, we really focus on screening and diagnostics. So I think about the cost that is incurred just getting the initial diagnosis, because often, with a woman, she has to have a mammogram and then maybe an ABIS and then maybe a biopsy, and it can be really costly just getting that diagnosis. So we really focus on alleviating that cost and then making sure that they get screened as early as possible so they have the best outcome.
Yeah, and I think it would, when we talk about screening, and Jackie, Christina, you both mentioned that early detection is really key when it comes to outcomes. And Christina, we chatted about this beforehand, but you mentioned it seems like the demand is really high for that kind of assistance, even just for that early on. And remind me, how many folks have you already seen this year that are looking for screening assistance?
Yeah, so we've already put over 500 people on, approved them for especially for youth fund, so that they can get their mammograms and biopsies and whatever they need. Yeah. So that demand, we used to get 40 in a month would apply, and we will get 40 in a week now, which is just, it's so increased. It's so important.
And I think we've covered a few different areas here, right? We've talked about direct medical costs. Shannon, you chatted about travel time, hotel. Are there other kind of areas or costs that folks might not think of if they haven't had this experience that you think are important to remember when we talk about the cost of cancer, when we think about that holistically?
I'd maybe add the cost of childcare. So what we're seeing, if a young person's diagnosed with cancer, a lot of times there's 2, 3, 4 siblings as well. And if that all of a sudden requires new, trying to find childcare, as anyone knows, is a challenge anyway, respite care or otherwise. And so that can be something that a family didn't have to worry about before, but now there's just another thing to add. And again, the whole time, the focus and the concern and the fear is with the child or the adult with cancer. And you have all these complicating factors. It's a tremendous amount of stress for families and for individuals.
Yeah. And I've heard from each of you as we worked up to this session, just some really insightful stories that put that into focus. And I want to give a chance to kind of highlight some of those. I think when we talk about anything with the word economics in the name, it's going to be a lot of numbers, and those are important, but ultimately those numbers represent people. So what are some of the people stories that have really stuck out to you from this kind of work when you think about the cost of cancer, whether that be direct or otherwise? I won't let us sit here for too long.
I can share a family story that was last spring. And as I mentioned, with rural families, it can be especially a challenge navigating all of the demands and the financial costs. I was talking to a dad at the Ronald McDonald House in Iowa City, and their son had been diagnosed with cancer. He's being treated at University of Iowa Health, Stead Family Children's Hospital, and it was planting season. And he was talking about how, first of all, no one anticipates that their child will have cancer, but then he felt so guilty that he even had to think about farm work And he was really torn with being here and being at his child's side, along with his spouse and their other kids, and the need to get back home for the family livelihood, essentially. And it's just heartbreaking to see that kind of stress on top of the primary stress with your child being sick.
And I don't know if Jackie or Christina, if there's anything that kind of brings up for you guys.
I can go ahead and kind of share what we've seen with advocates and trying to help uplift their story. Something that we've really tried to stress with talking about medical debt in particular is debt tends to have a stigma around it, so it's not an easy topic. Medical debt is not chosen, so nobody's going into the year thinking that they're going to get a cancer diagnosis or they're going to relapse or something like that. So we have really tried to stress that these stories are important no matter how big or how small that they are. Like, they're really they're your own and they're very personal. So I think we hear a lot of the stories that are impactful and devastating of somebody, maybe losing their farm or having to give up an asset to pay for their care or things like that. But what we have really found is that a lot of our volunteers have shared like just day-to-day stress of having debt collectors call them, and kind of that thing where I mentioned about delaying care, like how many debt collectors can I have calling me, but knowing that I have a treatment coming up? Is there part of me that wants to hold back on saying yes to that treatment until I can pay off one of my bills? So that's really what we have found a lot of, is no matter how big or small the story, it is like really personal to them and it can impact their day-to-day life. So we want to uplift all of these stories and make sure that stigma is gone, because nobody's asked. No, you don't go in asking for medical debt. You don't, a lot of the times you really don't even know what kind of bills are coming your way until they're there. So I think that's something at ACSCAN we've been really trying to do, is just trying to empower volunteers with whatever their story may be.
Yeah, and from my perspective here at the Cancer Center, I think what is so shocking is when you have patients that are really weighing like the cost of treatment and then either delaying or just choosing not to be treated at all because they don't want to burden their family with debt. And I just think that that's heartbreaking. So, and we get women who choose not to be screened all the time because they are concerned about the cost. And so that's why we do what we do every day.
And Jackie, you bring up an interesting point around stigma of medical debt, medical costs. And Christina, Shannon, you both kind of work with folks maybe potentially seeking services, seeking aid. Do you see that in folks? Does it seem that folks are kind of worried about seeking the help that is available, or how does that resonate with the work that you guys do?
Yes, we had a mom and dad who were staying with us while their child was in care, and they both held really, well-paying professional positions. And the dad, I think, had to. They tried to work remotely, do as much as they could away from home, but the reality was that he wasn't able to continue his employment. So she was talking about how all of a sudden they never, they weren't wealthy, but they didn't have to worry about money before, and now they're on one income, and just kind of the stigma of that, and feeling like they were always very proud that they were able to support their family just in day-to-day life, and then when this cancer diagnosis hit for their child, it just upended everything. And really, it was hard for them. It was a new identity, I think is the word she used. Like, this isn't us, but here we are with all this debt, added expense, and now decreased income. It was very scary for them.
Yeah, I agree with Shannon. I just think it changes families, and it does. It changes their identities and who they are and what they can afford, and it's tough. It's very tough.
Yeah, and I know, Jackie, you mentioned that statistic about how people who accrue medical debt and cancer survivors and cancer patients that accrue medical debt, they're not necessarily doing that because they don't have health insurance or they don't have coverage. And I think that does kind of factor in here. I mean, do you feel like that's a pretty common misconception that you run into folks when you're having these kinds of conversations?
Yes. Yeah. This is, I think that was probably when I was, looking at the survivor views survey, and as we're continuing to have conversations and looking at policy solutions around this is that a lot of these people have health insurance, and the fact that they're still unable to afford a large payment that won't be covered by their insurance is pretty shocking. And I think, that's like one of the main things that we've like really talked about with to switch a little bit is, we have a volunteer, she was on Medicare and she's retired and on a fixed income. So these unexpected costs that aren't covered by even Medicare, those are really big lump sums for somebody that could be on a fixed income. So, we're hearing it a lot. Yeah.
And I think people often think that they buy their insurance or sign up for their insurance when they're healthy, and then they just don't understand what kind of insurance they have until they need it. And they have really large deductibles, or they have out-of-pocket co-insurance or co-payments. And I think it just, like, all of them add up over time, and then it's just overwhelming.
And I know, Christina, I think we had chatted about this. Obviously, if you're going to get sick, if you're going to get a diagnosis, it's not going to be polite and wait until you are insured. And obviously some folks aren't going to get sick. And I think you've mentioned, it seems like, at least personally, you've seen an increase in folks who maybe previously were insured, but now need that extra assistance. Talk to me a little bit about that.
Yeah, we used to, our applicants used to only be about 20% that were completely no insurance. And I think now it's more like 45% just don't have insurance. So it is increasing. People are just choosing not to have insurance, or they're just not offered it, or they're unfortunately not working. So yeah, we've seen a huge increase.
And I want to talk a little bit about solutions. So each of the three of you kind of work in spaces that are solutions oriented and are trying to kind of take a swing at this really big issue. So we already kind of introduced yourselves and some of your organizations, but wanted to give a chance to see, are there particular efforts or projects that you feel like are making inroads in this, whether that be internally or that you think might be done in the future?
I think conversations like this are really important, and to be talking about, I love, Jackie, what you said about no one expects to be in debt and the stigma around that. And I think with solutions, I look at, just even the three examples that we represent, the American Cancer Society, like the Hope Lodge program, our Ronald McDonald houses, amazing events, like especially for you, for the community to want to help. These are some really concrete ways. If you can support those local programs, you are supporting families who are dealing with cancer, and it might not be paying their medical bill directly, but by offsetting some of those other costs for them, you really can make a difference. And we know that, Iowans, we pride ourselves on caring for each other and supporting each other. And so, I'd say take a look in your community and find a cause, maybe like one of our three that interests you, and know that you can make a difference in a very real way.
I can go and talk about some potential policy solutions that we've really focused on specifically here in Iowa. One, I didn't even come to my brain until, Christina, you mentioned the additional cost for a mammogram or a biopsy, or those follow-up appointments that may be needed for screening. So when I think of policy solutions, I think of it in two buckets. There's like the prevention side of how can we help prevent medical debt in the first place, and then the relief side. So if you are to incur medical debt, how can we provide some relief to you? So on the prevention side, the number one piece is access to healthcare. I bring this up specifically now because there are a lot of talks both at the state and federal level on, cuts to Medicaid and Having access to affordable healthcare is the number one way that you're going to avoid medical debt. That's the number one piece of it. We have been really trying to highlight the importance of a program like Medicaid and what it can do for patients, but also the community. Having a healthy community, having access to healthcare is economically better in the long run. People are able to go to work. People are able to live their lives if they have access to quality healthcare. So that is something that ACS Canada is extremely, we're very concerned about what's happening both at the federal level and at the state level, watching what kind of cuts could potentially come out of all of this. But I did want to bring up, there was one bill that moved through session this year that would have required health insurance for follow-up diagnostic and follow-up diagnostic and MRIs during for breast imaging. So really covering that whole continuum of screening. So I'm sure Christina can talk about that more in depth, but unfortunately that bill didn't make it to the end. So I know that that's something we're going to continue to push. I know Iowa Army of Pink and Susan G. Komen have worked really, really hard on that bill. We would love to see that get to the end, because there are women that show up there and talk about the thousands of dollars of MRI testing that they would get just during their screening process. So that's kind of sorry, I'm talking a lot, but that's kind of the prevention side. But then there's also the relief side. And some of the policies that exist within the relief side would be limiting interest rates on medical debt, prohibiting predatory collection practices such as home foreclosure, garnishment of wages, or seizing other assets. The Biden administration approved a rule back in January to prohibit debt collectors from adding medical debt to your credit report. So that was one step in the right direction. So those are kind of the things that we could do on the relief side. But yeah, I'll leave it to Christina to add some things as well.
No, that was really helpful.
Yeah, so I think a lot of things that we do internally, we do have, especially for you that pays for the prevention or the screening and mammography. But we also have like the Hope Fund, which helps with like gas cards, which so does the American Cancer Society, but it's so important, and that's always a need for transportation to like radiation. And then we also have financial navigators that will sit with a patient and help them understand their health insurance, and then also help them sign up for assistance programs that can help pay for part of the treatment, or just explain it to them. Because often they don't even realize that they have a deductible for their medical insurance, but then they could have a totally separate deductible for their pharmaceuticals. And so those are two big expenses that they're going to have to pay just right when they start treatment. So we really focus on trying to get ahead of it and help them understand what's coming, and helping them deal with the expense.
And Jackie, I am going to come back to you real quick. Actually, you mentioned that one example with the bill in the recent Iowa legislature. Can you talk a little bit more about that for folks who maybe aren't as familiar with what that would have changed? And I think that's a good touch point to ask. I mean, how did cancer in Iowa factor into this year's legislative session?
Yeah, that's a great question. So particularly this year and last year, I've really noticed a shift on how we've talked about cancer, and cancer is always coming up with lawmakers. So they are hearing about it. They are hearing about it from their constituents. They know that their constituents want action, which is great. I think that that's something so amazing. I know Representative Baith even joined one of the Monday panel to talk about all of the things that they worked on at the Capitol. As legislation does, a lot of it dies. It takes years and years and years to pass any meaningful piece of legislation. So I'm assuming you're referring to like the breast diagnostic bill, correct? Yeah. So what we have is only the initial mammogram is required to be covered at no cost sharing. So if you are called back by your doctor for any reason for MRI or I'm sure Christina can answer it better.
Yeah, like if you need to go back for a diagnostic mammogram.
Yeah.
Yeah, so if you go straight to the diagnostic mammogram, they don't necessarily cover it because it's not the screening mammogram. So really that bill was making it so they had to cover either of it. Is that correct?
Yeah. So it would be essentially up until diagnosis. So that whole continuum of screening up until diagnosis would be required to be covered by private insurance. So a really, really awesome bill. Unfortunately, we made it all the way through the House and then halfway through the Senate where it wasn't able to make it to the end. But that's not going to stop us. I know there's a lot of women out there that are really passionate about getting this bill to the finish line. So it's awesome to see them share their stories up there.
Yeah, and the state of Iowa also has a program called Care for Yourself, which is very similar to EFY, but it's on a whole statewide basis, and they give slots to each county, and then those counties can like screen up to however many slots they get for the women in their communities. And so that's also a really good program to access if people are needing screening mammograms.
And Jackie, I thought it was interesting how you mentioned that this topic, the way that we have it, whether just at the state level or in general, has really kind of ramped up the last couple of years. Let's expand that. And Christina, Shannon, how does that resonate with you when you think about how we talk about cancer in Iowa and specifically the cost of cancer for Iowa at large and for Iowa families?
I'm just so happy to hear that. I'm not really working in that sector of this. And so I'm really glad to hear that. And I'm not surprised because, my gosh, if we're not working towards legislation that first and foremost supports and protects our health, anything else that we're working on is irrelevant. So I'm glad to hear that.
Yeah. And we've talked solutions, and I want to ask, though, what are some of the hurdles you guys see in this conversation? What do you think is kind of standing as we continue this work to address this issue that we're going to have to do a little bit more work on or to climb over there?
I'd mentioned something. I don't know that it's a solution, but it's something we've seen with our pediatric oncology families. And I'm not intending to speak on behalf of any hospital, but I know that some of the programs, especially I think at the University of Iowa, I know that they have further developed their outpatient chemotherapy program, which reduces costs for families because, the hospital bill around an inpatient stay versus an outpatient stay is very different. And we've had several families who thought when their child came to the Iowa City, Cedar Rapids area that they'd be inpatient the whole time. And they, their treatment is such that they can do it on that outpatient basis. And so that's not only resulting, I would imagine, in a different type of medical bill, but it also, if you think about the emotional cost for a family, it's letting that child go home at night, be with his family, whether they're returning to their home or to a Ronald McDonald House, they're all together. They can sleep in a normal bed, have dinner, that sort of thing. So we're encouraged hearing that. And then also, obviously, telehealth, right, has come so far. And with many of our pediatric cancer kids, the appointments have to be in person for obvious reasons. But there are some consults, follow-up conversations that families are saying they were surprised they've been able to do via telehealth. And that saves them that financial cost of taking off work and driving back to another city and so forth. So we're always interested to hear that. And it's encouraging that maybe a little bit of that system is reducing costs and benefiting families.
Yeah, and here in the Cancer Center, we have something called the multi-D clinic. So when somebody's initially getting their diagnosis, they have one appointment with their whole team. So that is like their surgical oncologist, their regular oncologist, and their medical oncologist, and their radiation oncologist. And they can meet with a social worker and a dietitian, and they meet all at once. and they just do a really good plan of care, but that's one appointment rather than coming back here like 6 times. So they have done that, and those clinics are growing and we're adding to them, so that can reduce costs, and it's just beneficial to the patient.
Yeah. I would say when I think about hurdles, one thing that kind of comes to mind is it's pretty easy to feel negative when you're working so hard towards something and you don't see results at the Capitol, and in legislation and things like that. But reminding people that legislation does take 10 years to pass, and it always starts with people sharing their story. So that's how we've really been able, when I think of our most effective campaigns, there has always been one volunteer that has really taken it under their belt. They are so willing to share their story with anybody that will listen, and lawmakers love to hear your story. And so keeping up the fight sometimes it's hard to do all the time when it feels like you're not making any progress, but you are, and watching a story move like one lawmaker to another can be really effective, and that's how we get stuff done up there.
And Shannon, Christina, both of those responses, they kind of speak to just one of those really hard to measure things, which is like the cost of time. And it's, when you have these things, like you could be doing something else. Mm-hmm. So tell me a little bit more about that. What does that kind of bring up for you guys? Or what do you hear from folks when they talk about just the time that some of these things can take?
Yeah, I mean, a lot of patients just say that they feel like they're spending their life here because they're just here so frequently. Like, especially with radiation, they're here every day, Monday through Friday for 6 to 8 weeks, and that's draining on a family and their resources. Like you said, they can't be with their family and going to a soccer game because they're here. So.
Yeah, you mentioning a soccer game. More than once, we've seen a parent in our, Ronald McDonald House van going over to see their child, and they're on their phone watching, their other child play basketball or soccer, just trying to keep up and balance the needs of the patient with the general needs of the family, which don't go away during this time.
Yeah. And also, I mean, not just social cost, but even economic. I can imagine that having that kind of level, that depth of treatment obviously causes some workplace interruptions as well. I'm sure that's not what's top of mind necessarily for folks, but what do you hear from folks on that in terms of how the treatment process intersects with their professional lives and abilities during that time?
Yeah, we have a whole spectrum of it. We have lots of patients who are able to continue to work throughout their treatment, but then we have some patients that are so sick that they have to step away and heal and take care of themselves, and it is a balancing act that I don't know how these patients do it every day, but they do.
Yeah, I absolutely agree. And for pediatric patients, that they say, Dr. Audrey Evans, who was a founder of the Ronald McDonald House charity system, always said, a sick child is a sick family, and the same is true for a sick adult. It's that family unit, and everything stops, and you have to recalibrate and reprioritize. And it would be great if you could solely focus on, the patient's care, but these other realities, these other financial costs, unfortunately, don't go away. And it's just an incredibly scary and overwhelming time for so many Iowa families.
And Shannon, I think as the story you told about the farm family, to me, really speaks to that when you talk about there is an emotional impact to medical payment, to medical debt. And so it really is also closely related.
And it's not uncommon, as we all know, when you're under prolonged stress, even as the caregiver, that can affect your own personal health. Maybe you never had anxiety before or a panic attack before. And we've seen that with families who had been, healthy in that way before, but what they're having to live through, all of a sudden, mom has got to go to the doctor because she's experiencing, something of that nature. So it can really be exponential.
And Christina, go ahead.
Oh, I was going to say, yeah. And so we work with a lot of moms who have cancer. And so they're like the center of their family, and they really organize everything and make everything go. And so we have a program that is funded by Aiming for a Cure. It's local, and they give us money, and I think they give Blank Children's Hospital money, the U of I, all over, and we do backpacks so the mom can bring in their the list that their kiddo needs for their backpack, and we go and we shop and we put everything in the bag and then just give it to her. And like just that small act is like huge because it's such a relief that one, they don't have to pay for all of those supplies, but it's just taking one more thing off their plate that they don't have to worry about. So it's a cool program. Yeah.
And it really is a lot of those. It can be one small thing, like you said. I remember we had a family, I think they were from 3.5 hours away. So I'm thinking of Iowa, so kind of on the outskirts, and came in, and she got up. It was the first day that they were with us, and she was kind of crying. And I just said, how are you? Anything we can do for you? And she said, I'm so happy you have coffee. And we thought, oh my goodness, but it really is. You're away from home. Your child has cancer. It can be those little things. So as Jackie said, in thinking about legislation and just stay the course, and every little story, everything helps, all of these little services too. I think there's no program too small if it's helping to support Iowa families with cancer.
And I love that quote about how a sick child can really make that resonate outward for the whole family or a parent. And I think I'd be curious, do you guys feel like we can apply that metaphor to Iowa at large? Because I imagine if you think about all of us as kind of like one big Iowa family, you have to pardon my cliche, that if you have folks that are getting sick, it's affecting the state overall in terms of if folks can be at work and engaging in the community in that way. I mean, how does that conversation factor into what you guys do? Or maybe Jackie in particular on the state law side, how does that factor into the conversation in terms of what Iowa is losing overall when folks are redirecting their effort and resources into treatment?
Yeah, we talk about that a lot. Specifically when it comes to Medicaid, I think that there's a little bit of a stigma around specifically Medicaid when it comes to like who utilizes it and what. But what we really want to show is that a healthy population leads to overall success. So that is something we have really tried and to kind of shape the narrative up at the Capitol of, okay, if we are allowing our Iowans in our population to have access to healthcare, they can be with their families, they can be active members of the community, they can go to work, they can do all of the things that make them, a person and a member of society and have a positive impact. So that's kind of really something we've been trying to shape that narrative up there a little bit more around. All of the bills, but specifically around Medicaid is something we focus a lot on. That, yeah.
And small town Iowa, especially if when you hear that someone in your community has cancer, as you're saying, Grace, it's a rally. I mean, we know each other, and it doesn't just have to be small towns either, or communities throughout the state. The community support is overwhelming and wonderful. And I think that's a really neat thing about Iowa. I know we had a family from the Mennonite community who had a child with cancer, and our little buzzer rang at the Ronald McDonald House, and there were 12 ladies there holding casseroles, coming in to, meet with the family, provide food to share with other families. That support, we always say you see the best out of Iowa when we're going through some of our worst things. And I think we see that when cancer is affecting someone in our community that we care about, we rally.
And Jackie, not to put you on the spot, but what's the response been like for that conversation at the State House in terms of maybe framing this as the impact not just on individual families or individual patients, which is already so big and grand, but what's the response when you guys try to put that in kind of the statewide impact or the statewide sphere? What are you hearing back from folks?
That's a great question. I definitely think it's an ongoing effort to shape that narrative. I think we have the best success is when we have somebody sharing their personal story that can relate it back to their hometown or their small Iowa town that's represented by a member up there. But I do think it's kind of an ongoing process to shape that. But I think specifically since cancer has been so talked about across the state, and we're doing so much work to bring resources outside of just like the metros. There's the 99 County Project that has been going on, and seeing that, I think lawmakers have been really awesome and really interested in trying to learn more about how cancer is impacting their district. So I'm very proud of all of the partners that have come together to talk about this, and even like I said, for having this conversation to keep it elevated.
I think we can apply that same kind of question with Christina. Shannon, when you talk to folks about the kind of work that you do in this conversation, I mean, what's the response that you hear from folks, or what's kind of the pulse, in your opinion, of general Iowans when it comes to this topic?
Wow. I mean, I kind of wanted to like jump on Shannon's point when she was talking about how like our communities rally, and we have, especially for you race in October, and like we let everybody who registers, they can join a team, and like we have 585 teams and over 16,500 people walk. So if you come race day, it's just all community. It's like everyone coming out to support, the people who have fought it, the people who are fighting it, the people who have passed away. It's just like the best community event. And I just feel like we just live in the best place. But what was your question? Sorry.
I was just curious. I mean, Jackie talked a little bit about having that conversation about community impact, whether that be, in this case, we're kind of talking economic, but in general. Yeah. So when you have conversations with folks, maybe just outside of work, and you're like, oh, well, like, this is what I do. What do you hear from people? Do you get the sense that a lot of folks are thinking about this, or does it seem to be one of those things that a lot of people's first interaction is if it happens to them?
No, I think a lot of people are thinking about it because I think everyone we know is impacted by cancer. So they have a friend, a family member, they've had it. So I think the impact, you'd be hard pressed to find somebody who hasn't been impacted by cancer. So I think there is always great support.
I agree with that. And a lot of our families say, we have a cousin whose child had cancer, or, a woman I work with, her child has cancer. But also, too, even being aware of that, I think for each individual and individual family, it still seems like something that is awful and is happening to other people often. And so when it is all of a sudden a part of your life, we've had so many families say, we never thought we'd be here. We never thought we would need these resources. We never thought we'd be in a position where we're stressed about money and how to pay for all of these things. So it just makes the continued conversation all that much more important, because unfortunately, as we've all said, no one plans for it. And when it's here, you don't have time to plan. You have time to, oh my goodness, what do we do for treatment? You don't have the time to take a step back and try to prepare for some of these other financial costs.
I think so much of that really does speak, and it seems to have been a theme throughout, just the importance of stories and people sharing their experience. And I've just really appreciated that about kind of this conversation. And I do think it does make Jackie's point earlier kind of poignant, though. I think even when it's not medical, I feel like people are kind of nervous to talk about money, nervous to talk about finances. So I really appreciate the chance to kind of have an open and honest conversation about that right now, because that might not necessarily be part of the conversation folks are as comfortable with. And I know we're nearing the end here, so I don't want to run us over, but are there kind of any key takeaways you want folks to have here, or rounding us out, what do you want people to keep in mind when it comes to this topic? Just kind of open floor to rounding out this really solid discussion so far.
I would say from my perspective in working directly with families, not so much around the policy or actual medical care, but I would say, reach out. I think there are a lot of times that families are surprised to learn, like the resources that Christina was sharing or resources we have available, or American Cancer. There's some stigma too, I think, in asking, oh my goodness, my wife has cancer, my child has cancer, and the medical conversations are more clear and direct, appointments and talk to your medical care team, but make those calls, talk to your, local organizations. We hope there are supports, in most every community of some kind, and don't be afraid to just reach out and say, we need help. This is a situation we didn't expect, and here's where we sit. And hopefully you can be connected with something that helps offset some of these financial and emotional strains.
Yeah, I would echo Shannon's point, is asking for what resources exist. I think that's a really hard thing to do, and there's so much out there. It's hard to almost figure out where to begin sometimes. In addition, I always like to say is that, anybody can be an advocate. It seems kind of scary in the beginning. Talking to your lawmaker it feels intimidating until you get to do it a lot. And then people they really enjoy feeling like them talking to their lawmaker has made a difference. So if you're at all interested in sharing your story, no matter, how big or small, we have lots of, caregivers, survivors, patients, anyone that's been impacted by cancer on some form or another. Don't hesitate to ask how to do it. And we're here, we provide resources to help you and make sure that you feel, supported and able to do it successfully and not scared to do it. But those stories are really what are going to matter, specifically moving into the next couple years, when I think this particular topic is only going to be more of a discussion among the cancer community. So yeah, that's what I would say. Anybody can be an advocate, and you can do it. Yeah, it is meaningful.
Yeah, so I agree with Shannon and Jackie. I think just don't be afraid to ask for help. Reach out. People love to help. I think make sure that you have good insurance. Maybe look at it before you actually need it. And then also, obviously, listen to your body, get your screenings, take care of yourself. The earlier you can find something, the cheaper it is. So, you want to make sure that you're taking care of yourself and staying healthy.
Thank you so much. I've just really appreciated this conversation, and the three of you taking some time out of middle of the day over the lunch hour to have this conversation. As you guys know, it's super important, and I'm just really appreciative of the time. We are at about coming up on 5 minutes here. So just want to kind of take a chance to also thank everybody who kind of joined us today on Zoom and joined us online. This has just been a really great week so far. This is day 4 of 5. And so it's part of our year-long Iowa Ideas program. We will have one more session tomorrow, and that is going to also be at noon, and it will be on advancements in screening and treatment. So I would definitely recommend giving that one a listen, checking in for that conversation as well. All of our sessions are also recorded and you can watch them back later. That means if you've missed one of the first 3, I hope you haven't, but if you did, you can watch them and we'll have them up there for folks. And so again, just kind of rounding this out. This has been 4 of 5 for this week. We'll have one more in-depth week this year. It's focused on energy and environment. So don't forget to kind of keep on the lookout for that. Follow the website and for information on there. And then our full Iowa Ideas Conference is going to be in October. It's October 2nd and 3rd, and registration's already open. So if you've enjoyed today, if you've enjoyed this week, you can get a little bit more later in the year. That one's going to be all different topics that affect pretty much all corners of the state. So don't want to miss it. That is also going to be held virtually, so we would definitely invite you to that. Rounding us out, just thanks again to all of our attendees, all of our panelists, as well as just our sponsors. Again, we have that presenting sponsor in ITC and the in-depth sponsor in Unity Point Health here in Cedar Rapids. Just thank you so much for everybody, and I hope that you've taken as much away from this as I have. And so I think we're about wrapped up. I'll let our panelists say a quick goodbye and thank them again.
Well, thanks so much for having us. And Christina and Jackie, I really learned a lot from the 2 of you today. So I'm really glad this conversation is happening. And thank you, Grace, to you and all that are involved in organizing it.
Yes, thank you. It was a pleasure to be here. I really appreciate elevating this conversation. Thank you.
Yes, thank you. Grace, you did a good job. I appreciate being invited, and you ladies were wonderful.